Kia ora. Kia ora anō. Ko Joe Hikaka tōku ingoa. We are presenting sort of on behalf of a whole group of people. Oh, so sorry. I'll get Mariana to introduce herself too. I have seen the names of some people online, and there's other people in the room all involved in this work. But we will get into that a little bit later on in the presentation.
Thank you, Joe. I'm Mariana Foxcroft. A little bit more, okay. Mariana Foxcroft. I work for InterRAI as an education quality manager, and I am the project lead for InterRAI on this particular project.
So today we're going to be talking about Paiarahi supported InterRAI checkup self-report, which is a different kind of assessment that isn't routinely used in Aotearoa currently. And you can see on the bottom right the different organisations involved. Korowai Aroha, who are a kaupapa Māori health and social service provider in Rotorua, and part of Te Arawa Whānau Order Collective, Te Whatu Order Lakes, InterRAI New Zealand, or Te Whatu Order InterRAI New Zealand, and Waipapa Taumataro, the University of Auckland. So Checkup Self-Report is a different kind of InterRAI assessment tool, and it asks people, or it helps people to identify and report on their own perspective of health and well-being. And as I said, it's not currently used in New Zealand, but it is used in other countries internationally, particularly in those sort of low-resource countries. And I was so I think after the knowledge exchange last year, Bridget had the idea that perhaps we could use Checkup Self-Report in Aotearoa. Sarah gave a great presentation this morning that discussed issues with access to InterRAI, and I'm sure a lot of us have seen that in our own practice. So there's, all those stages that you can access an InterRAI assessment are also places that you can be stopped from accessing InterRAI assessment. So even knowing that InterRAI exists and whether and that an assessment is linked to ability to access care, right through to having been referred and sort of assessors being very busy and maybe delays in accessing those, and that varies across the country. And so we thought, Bridget thought about how a Checkup Self-Report could be used, and was in discussion with Korowai Aroha and within Te Arawa Whānau Order Collective, they have roles or positions called Paiarahi. But I guess that although we call these roles now, and they've been used within Te Arawa Whānau Order for the last 12 years or so, the history of navigation is linked strongly in the whakapapa of Te Arawa. So Homai Tawhiti in Hawaii said about sending his son Tamati Kapua, the chief navigator for Te Arawa Waka, across the seas to Aotearoa and landing in Makatu. And so I guess throughout this project, we're reminded by Whaia Hariata, I'm not sure if she's online or not, about the role of navigation and the whakapapa of the Paiarahi that are currently working in these whānau order navigation roles today. And so whānau order navigators, or Paiarahi, as the Te Arawa term, are involved in advocacy for people that they work with, care navigation, coordination, and are steeped in local language and tikanga in Te Arawa. And so our objective was to develop a process to support Paiarahi facilitated Checkup Self-Report in the Te Whatu Order Lakes region, and to test the feasibility and acceptability of Paiarahi facilitated assessment.
Yes, as Joe explained, there was I'll talk a little bit about the timeline and where we are up to now. So as Joe explained, Dr. Bridget Meehan started off this project or this process and this idea quite a while ago. And in that time, we had lots of kōrero with stakeholders, older Māori and whānau in the community, where we had, when Korowai Aroha came on board, particularly we went to see them. We had hui in the community. We showed them the assessment tool and asked them their opinion and feedback. We took that feedback and went back to the ISD, the international InterRAI developers, talked to them about our idea and got their feedback and input about it as well. And then we started the ball rolling. And I'll talk more about the training and how we did that, develop that as well. And then we got funding made available from InterRAI. Thank you, Mark, for so that we can get Joe on board as the researcher. And there was this agreement signed between Korowa Arawa, InterRAI, and Joe as our researcher. So at the moment, we are in the recruitment and intervention phase. This is where we are now. The Paiare is doing the recruitment work with the support from our educators. And I'll do a shout out later on for all of those, but in particular for Katrina Lamb and Luisa De Simo, who is the two InterRAI educators who's closely working with Para and Cheryl, who is our two Paiare that has been trained to do this work. And I'll talk more about them a little later on. So yes, they are in the process of recruiting and doing the assessments, or they don't do the assessments, they support people to do their assessments. And then we'll move into the next phase, hopefully in April, May, so that we can finish off this project by June, end of June, which will be Joe's big job. Part of what we did was we wanted to make sure that we align what we're doing with the Māori values and making sure that we reflect it throughout our assessment tool. So we incorporated this table into our assessment tool so that we can show how we do that throughout the assessment process. The next thing we did was one of the suggestions from one of the hui that we had with Kohiki, Kaumatua, was that they thought that adding te reo words in Māori, te reo words of phrases to the assessment tool would make it a little bit more understandable, easier to navigate maybe. So we did that. We started that process. And then we asked for professional help to get that properly done. And Whaia Hariata Virku, she got Iwi Te Whao. He's the person who did the translation for us, that work. We got his feedback, implemented it, and then so the assessment is done on paper by our participants and then taken back by Paiare, who is then loading it up into the system.
And I guess something within that was ensuring that the translation still stuck to the key question around each item. So that's one of the big things with InterRAI. Another thing is that te reo was te arua reo. And so going back to the people where the assessment was being implemented, I guess. So this intervention isn't just about doing an assessment, it's ensuring that Paiare have the opportunity to carry out their standard sort of model of care, which involves a holistic approach to wellbeing and care navigation. So it's not just about completing an assessment, but when there is things identified, it's about Paiare working with others and navigating through which services people need to be connected to ensure their wellbeing goals are met. And so Paiare have lots of different options that can come out of an InterRAI assessment, including referrals to other care providers, and that could include a formal NASC review to access publicly funded care, but also setting appointments, obtaining funding to get, for example, home modifications, and accessing group activities. We had pretty open inclusion criteria. The idea, I guess, one of the key principles of this was we were wondering if self-assessment might identify people that otherwise can't access a NASC assessment. So there's Māori 55 years plus and those enrolled in Korowai Aroha General Practice, because that allows us to be able to access some of the clinical information a bit more easily. They had to be community dwelling and they had to be able to understand written or spoken English, because each of the items or questions is delivered in English primarily, but with some reo alongside. Exclusions were previous InterRAI assessment, on the waitlist for needs assessment, receiving publicly funded home supports, residing in aged residential care, and all of those because we didn't want to add extra burden to people that were already accessing sort of NASC and home cares or care and residential care, because yeah, I guess the checkup self-report is sort of more aimed for those that haven't even accessed the system yet, and then of course those unable to provide informed consent.
Yeah, so the initial referral basically comes from the providers, so Korowai Arawa, so the people working in that provider or that organisation might identify the people that's appropriate for our assessment, to participate in the trial. And they then give the referral or the information to the Paiari, who then makes the first contact and start building that relationship with the person. They would hand them the assessment tool on paper-based, and they would self-complete it, but they would give them the opportunity to have support from the Paiari to complete the assessment, to help clarify. We did train our Paiari not to change the questions, to stick to the intent of it, so that we can get the accurate picture at the end. Throughout that, the Paiari makes sure that if there's any well-being concerns, it is addressed and person is supported. Part of it is also gaining consent and making sure that they are willing to participate and following the protocols that we need to for this trial. I forgot to mention that we've got ethics committee approval, as well as this trial is registered as a clinical trial. And then they go back and they do the follow-up. So they will go and pick up the paper form and then load it into the Momentum system. And then, from there work out what is the needs and then follow through with NASC. So NASC will see all the assessments in this trial. It doesn't necessarily mean that they will have a NASC assessment or NASC follow-up after that. But in this trial, they will be involved in looking at the assessments. The training, we developed a training. We used a co-design process when we developed our training. So when we started the HUI processes prior to Joe coming on board, we had regular contact with the Paiari online specifically, because we are all over the country and they are in Rotorua. And we connected with them that way and asked them what would they like to see. We gave them some examples of online modules that we have developed and asked them what do they think about it. And then we developed the training. So the training was a one-day workshop in person and this is actual photo of them doing the training. We did this last year, October. We had the full day and we decided to do it prior to ethics approval, so that we are absolutely ready to go when the ethics approval came through. So, and it came through right before Christmas. So we had to wait for Christmas to go. And then January, we were able to launch, with the assessment. So we did a bit of a refresher. And as I mentioned before, the educators are very involved in supporting the Paiari to make sure that they understand the InterRAI assessment, the process, the momentum, the research processes, and everything that is involved with that. So NASC also came. So Darshana Patel, who's the team leader at NASC, she came into the session as well. And the Paiari felt that was so helpful for their general role to understand what NASC does, so that it was helpful for them to explain to other people that has already been referred for another NASC assessment, just explain what processes are. Yeah, so.
And I think that's a really good point, Mariana, because if people didn't want to participate in the research, they didn't have to, but it didn't mean that they didn't get Paiarahi support from the wider Korowai Aroha Centre. And I think with this project, it wasn't just about this actual project, but supporting local research capacity and capability building. So one of the Paiarahi is going to be qualifying next month with a level 6 NZQA accreditation, assessment and research that they've been doing sort of alongside the work they're doing as a Paiarahi. So those sort of things are really exciting too. So how do we measure success for this project? Well, they're some of the stakeholders online that we talked to about that. So what outcomes are we going to measure? How are we going to know if it's successful and whether it's feasible and whether people would want to continue using this kind of thing? We also wanted to try and balance a really good a really good outcome and evaluation with reducing assessment burden. So InterRAI can already seem quite intensive to some people with a number of questions, and we didn't want to add a whole lot of assessment questions in that might sort of mask their impression of the InterRAI assessment. So we tried to we're mainly using secondary data and the interviews, sorry. So our primary outcome measure is holistic wellbeing, and we're doing that with a modified Hua Oranga. Hua Oranga is a quantitative kaupapa Māori assessment tool, originally developed by Te Kane Kingi and Sir Mason Jury for mental health assessment, and a modified version just is 4 questions relating to the 4 domains of Te Whare Tapawha in terms of how a person is feeling at that moment in relation to each of those domains, so physical, mental, spiritual and whānau health. We're looking at access to care, so the number of assessments that are completed, also healthcare utilisation, strengthening wellbeing at multiple levels. So we are interviewing koike, Paiarahi, delivering the intervention, and whānau to understand experiences. We're looking at hospitalisations, and so Te Whatuora Lakes have been really great in enabling us to be able to access that sort of information. Providing services that support independence and closer to home, so understanding whether recommendations were taken up and whether they aligned with what people wanted. As I said, improving the capability and capacity of the Paiarahi workforce, and also whakawhanaungatanga, tikanga, manaakitanga, and whether it's tika and pono, I believe. So we're wanting to look at rangatiratanga and wairuatanga. So is the assessment fit for purpose? And I think one of the key questions I think we'll be following up with is maybe not just about the assessment. So did you like the assessment or not? But if assessment has to be done anyway, is this a good method to do that? Is this a good way for it to be done? We're also checking that the assessment maintains its methodological design within InterRAI, whether it's an ethical sort of process around research as well as the intervention, and whether it then fits in with, I guess, a sustainable kind of service delivery model. And we're up to acknowledgements. And at this point, I would like everyone online or in the room that is part of this group to make themselves available for the panel discussion. We're sort of asking people to talk through their role because it has been a really different group of people and everyone needing to come together to support this. Thinking about, the impact of the Paiarahi role, and there might be other things that you all have questions of the panelists too, but first and foremost, is there anyone online that would like to contribute and discuss their role? Kirsty?
Kia ora whānau, ko Kirsty Walker toka ingoa. I am part of the commissioning team here in Lakes in Rotorua. So I was part of the original team, I guess, that started up this project, and the idea actually came alive in early 2021. So we're actually at the 3rd year of the journey of this project. So I was tasked with seeing if we could make it work here in Lakes, and due to our GM of planning and funding at the time, who was Karen Everson, who sat on the InterRAI board. So she introduced me to Bridget Mahan, and I guess the story has travelled from there. So my role's really been about trying to bring as much support from a DHB perspective as we can. Yeah, that's probably me. There you go. I'll hand over.
Thank you, Kirsty. Is Darshna online today? No, okay. And Ariata, is she there? Okay, that's a pity. Gabes, would you like to also add? Is Katrina there? Katrina, did you want to say something? No pressure.
Hello, I don't have a camera because I'm just traveling at the moment, but yes, I'm Katrina Lamb. I was or am an educator that's been involved in the project. I only came in later last year so that there'd be a second educator. Has been a great experience for me working with the Paiarahi and the whole team and have really enjoyed it.
Yeah, and we appreciate everything you do, Katrina. They have almost weekly calls with the Paiarahi just to answer little things about methodology, maybe about, the issues with the online, with the momentum system, and it's going really well. So thank you very much for your work, Katrina. Is Darshna, did you want to say something?
Hi, just want to say that this is such an amazing project. Very, very excited for the work that's going on, because one of the key things for NASC is that we're well aware that our Māori population particularly access NASC services far too late. You know, we're so excited about the way that this can reach our Māori so much earlier and get them involved in services that we can provide and just accessing healthcare a lot earlier. So yeah, excited for the work and proud to be part of the team. Thanks.
Thank you, Darshna. Gabes?
Oh, you will have met me before. I'm the principal advisor with InterRAI, so my role in the steering group is really to support Mariana as project lead and Jo in her research. We have linkages within InterRAI with our culturally appropriate assessment model pilot as well, where there are so many areas that cross over with this piece of work. So it's very exciting to see work in both those spaces moving forward. And I'm particularly interested in anyone that's got conversations around where this may go to in New Zealand going forward, because we can see a real role, particularly in primary care, that's under-resourced to reach out to people who aren't known to services and bridge that gap utilising non-clinical support, which is really an important part that we haven't had before.
Karen Foley.
Hi everyone, I'm Karen Foley, one of the education and competency managers, and I had a reasonably minor role in this project, just being a support person to the great job that Mariana's doing. But one of the big parts that I played was helping with developing sort of an extra little tool for the Paiarahi to look at the scores. So the kamata would fill out the assessment, and if they scored highly in any area, we developed a little tool that would help then the Paiarahi to think about what that might mean, and then connect with Darshna at NASC or their own services at the GP practice to think about next steps, and with the help of the educators, talk through the assessment and consider those next processes.
Thank you. So shall I do the acknowledgements?
I think I just wanted to mention as well that I think that the teams come together. There's been previous relationships, like Kirsty's talked about the relationship with Bridget. Kirsty and NASC have already obviously had a relationship with Korowai Aroha. I've worked with Korowai Aroha and the Paiarahi on other research. So there's lots of connections that have brought together the team. So it wasn't sort of just randomness that brought that together. The other thing is just some little anecdotal results. We haven't done any sort of interim analysis, but anecdotally, the practice think there's probably around 2 out of every 5 that would need an NASC assessment, and almost for everyone, the koiki or older Māori have been able to complete the assessment themselves, and it's just been like if they've accidentally skipped over a page, the Paiarahi might contact them, but there's still that wraparound service as well.
Thank you. So I'll do acknowledgements and then we can open the floor for some questions. So I want to just thank you, Joe. Thank you very much for all the work you're doing on this project. You've given a good direction and guidance, and it's really, we look forward to the results and the publication of your paper. So really going to be great. And maybe next year you can present it to us here, the findings. So thank you for that, Joe. And I want to also thank my team, InterRAI team. I want to say thank you for all of you, from system clinicians to admin to management, GABES, everybody that has been involved in pulling this together. It's really been a great team doing that. I also would like to say thank you to Hariata and her team, Para and Cheryl in particular. Without them, there's no project. They are absolutely the grounding for this project. And then also thank you to Iwi Wao, who was the translator, who worked with us closely to do that properly. And then also all the participants in this pilot project, all the koike, all the whānau and support people that's involved and going forward as well. So thank you very much for listening. Okay, so we've got 3 minutes for questions. If anybody has any questions, online.
From Harapati, it would be important to have a robust train the trainer package that would be very valuable to bridge the community and assessment.
And so do you mean coming from InterRAI to train the people like the Paiarahi, or do you mean?
Harapati, do you want to answer that?
Kia ora,
Kia ora.
e hoa.
Tēnā koutou katoa i tēnei wā, te hui hui toa whā. Great to be here online. Unfortunately, I had a phone call halfway through the presentation, and so I've got another silly question about how te kupu or koike. What does the koike mean? But yes, working alongside the whānau, so it's about how the education for the self-assessment tool, and you're talking about the Paiarahi capacity, how and or what training they will have to, because what I see a lot is, and sitting here reflection, is our ability from the assessors and or clinical interface to do the cultural translation of clinical need to then the assessment tool. So we do miss a lot of critical trigger information because the assessor isn't able to actually understand the cultural setting or the how people present from the community. Basically, just a cultural lack of understanding. So hence why the thought around train the trainer, so that we can support clinicians to have a better understanding within a hui process. These are some of the indicators. And so a kaumata wouldn't be doing this Paiarahi or self-assessment tool. It'll be them and their whānau doing this tool together. So that's the kind of functional part of it, but more importantly, the clinical assessors even to having the understanding of how to translate what they see, be it elder abuse or the dental care staff. You know, we just don't dig a little bit deeper because we feel out of our depth a wee bit.
So the Paiarahi are sort of tūturu te aroa. They are 22 and 23 generations on from Ho Mai Tawhiti, and so really steeped and have a lot of community connections. And so the whānau's often there, and we're sort of recording where the whānau are there. We're also in our evaluation understanding from Paiarahi their level of comfort administering this assessment, whether they, you know, that gut feeling that's been talked about today, whether they had a gut feeling that actually an ASK assessment might be needed. We're also thinking through what could self-assessment look like in terms of direct access to publicly funded services. So not repeating it again necessarily with a trained NASC assessor, because internationally there's really good validity with the self-assessment and the assessment completed by a trained assessor. Yeah. And koike is the te aroa kupu for Pākeke. Older Māori, but not kaumātua status.
Thank you. Thank you. Thank you all. A great presentation and really great work.